everyone, and a very warm welcome for today's session. We are very excited for today's session because the topic that we have for you today is on autoimmune diseases. So, I'm sure you would have gone through the newses recently and seen that a lot of people, and I'm sure in the near vicinity, your friends, family, a lot of would have told you that there is a growing trend towards autoimmune diseases. But what exactly is an autoimmune disease? Why does it happen? And why recently the trend is going upwards is what we would want to discuss in today's session today. And we are super related to invite the guest today that we have, Dr. Nandita Shah. Dr. Nandita is a homeopath and an author. She began her medical practice in around 1981, so she is a stalwart in this industry, and she has received so many accolades and so many awards throughout her lifetime. She's also the winner of the Nari Shakti award, and she works with for a NGO organization called Sharan, and ma'am has done great work around reversing diabetes and autoimmune diseases and other similar medical conditions. So, without much ado, I will hand over the floor to Dr. Nandita to share her insight with us and enlighten us more on this topic. So, over to you, ma'am. And thank you so much for your time, for sparing the time to address our audience today.
Thank you, Dr. Urvi. And it's my pleasure and honor to be here with you all today. And I think this is such an important topic because autoimmune diseases are increasing day by day. So I'd just like to know from the audience, is there anyone here who is either suffering from an autoimmune disease or knows someone who is? And you could type in the chat box so that Dr. Urvi could give me the response.
So, yes, I have received a few responses that are saying yes, someone is writing they personally are suffering from it. Few have written that there's a family member who is suffering from that. Few have mentioned kids also that are suffering from autoimmune diseases.
Sadly, so many people are suffering from it. I just want to introduce you a little bit more to our organization. Our organization is Sharan, and Sharan stands for Sanctuary for Health and Reconnection to Animals and Nature. It's an acronym. And how did this name start, and what has nature and animals got to do with health? Let me tell you in real brief. I actually suffered from an autoimmune disease in 1997, and in 1999, I decided to move from Mumbai, where I used to live and practice, to Auroville, where I live now, where I have a little house on the beach and it's a very open house. And when I moved there, a cat moved in with me. I had never lived with an animal before. But as I started, we were cohabiting together. And as I started observing the cat, I realized that animals in nature know how to be well. How can it be that my patients are getting sick all the time when animals in nature know how to be well? And so I started thinking that anyway, in general, medicines never cure. And this is not just for autoimmune diseases, but this is for even infections where an antibiotic can only kill germs. It cannot prevent you from the next same infection. In fact, today I just met a patient who has been on antibiotics for months and still has urinary tract infection. And this is just because the minute an antibiotic course starts, if our immunity has not improved, the antibiotics are going to, the germs are going to get us again because the germs are everywhere in the environment. So, if we want to get healthy, we really have to see why we have the disease and what do we have to do to change. So I moved to Auroville because I myself suffered from an autoimmune disease, an acute autoimmune disease called Guillain-Barré. And I'll tell you a little bit more about that. But I decided not to heal myself with any medication. So just to let you know, Guillain-Barré is an acute full body paralysis. And I was totally paralyzed within a short period of time, so much so that I could not even turn in the bed. Of course, all my doctor friends and even other people told me that I should get myself admitted in the hospital. But I knew that the treatment of that time, which was steroids and immunoglobulins, have a number of side effects, and I don't want to undergo that. So, with the help of my father, I decided to treat myself entirely at home. And I also got a hospital attendant to attend me morning shift, night shift, because I couldn't even turn in the bed. So I couldn't eat, I couldn't do any bodily functions myself. But I came out of it, and this taught me a lot about not just treating autoimmune diseases, but treating all kinds of diseases. I've actually written a book called Reversing Diabetes in 21 Days, and that's only because that's something that we can observe ourselves at home with the help of a glucometer, and you can see the results immediately. But let's go right away into today's topic, and we'll talk more about that right now because we only have a limited amount of time. So let me get into that right now. I'm going to share my screen now, and I'm going to just, oh gosh, sorry about that. I'm just going to play the PowerPoint that I have. And I told you a little bit about Sharan already. And today we're going to talk about autoimmune diseases, their causes, because remember, if we remove the cause, we can get rid of the problem, and their treatment. Like, how do we treat in a way that's different so that we can actually get results without continuously taking medication? I already told you that I suffered from Guillain-Barré, and Guillain-Barré damages the myelin nerve sheath, the nerve sheath that is, covers the nerve, but not the nerve itself. So the myelin sheath is totally destroyed. In autoimmune diseases, auto means self, immune means we are we have antibodies that are fighting our own cells, destroying our own cells. And in my case, it was the myelin sheath, the sheath around the nerve that was getting destroyed, leading to paralysis. And the symptoms can lead to total paralysis, which means that you might even need respiratory support. Or I could feel that myself, I could feel that I wasn't even able to think completely the way I could before. So, difficulty in breathing, all these things, especially for me, difficulty in digestion. Now, what is immunity? Immunity is a very, very important part of our life because we live in symbiosis with germs, with bacteria, with viruses, with parasites, not only outside in our environment, but also in our gut. Do you know that we have good bacteria in our gut? And the number of good bacteria in our gut microbiome is 10 times more than all the cells in our body. And it's up to us to live in symbiosis with this gut microbiome because the gut microbiome has a number of functions. It helps in digestion, it produces short chain fatty acids, it also produces, like it has enteroendocrine glands, endocrine glands in the gut which produce hormones such as serotonin. Serotonin, for example, is a happiness hormone. And do you know that 90% of the serotonin is produced in the gut? So it's so important for us to live in symbiosis with the organisms inside our body as well as outside our body. In fact, when you take an antibiotic, you may notice that you don't feel so good. Your digestion isn't good, your mood isn't good, and that's because so many things are affected when we not just kill the bad germs, but we also kill the good microbiome in our gut. And therefore, it's really important that we build our immunity. That means we build antibodies against those germs rather than kill those germs, say, with an antibiotic, because that affects a lot of other things as well. And our body is always producing antibodies so that, we are, without even knowing, we are fighting different organisms, germs, and viruses all the time. So then what are autoimmune diseases? Autoimmune diseases is when we produce antibodies against our own cells. Now, our body never produces or never does something which is harmful to ourselves. Then why does this even happen? That's what we're going to look into. So before we go there, let's just look at what are the common autoimmune diseases. And you may have heard of some of them. Rheumatoid arthritis, very common. It's an autoimmune disease. And multiple sclerosis, lupus, vitiligo or leukoderma, ankylosing spondylitis, type 1 diabetes, psoriasis or arthritic psoriasis, irritable bowel disease, Crohn's and ulcerative colitis, Graves' disease. This has got to do with the thyroid, and Hashimoto's thyroiditis as well, and myasthenia gravis, vasculitis. In fact, there are more than 100 different types of autoimmune diseases, and these, each one affects different parts of our body. So there are diseases that affect the thyroid or the bones or muscles or skin or lungs. Or for example, in my case, it was the myelin sheath of the nerves, but nerves can be affected as in myasthenia gravis or Guillain-Barré, and GI tract and blood and brain. I mean, today we are suffering from so many problems. And usually once you get an autoimmune disease, the doctor tells you that you need to take a immunosuppressant, something to stop these antibodies from destroying your own cells. Remember that at my time, there was no immunosuppressant. It was just immunoglobulins and steroids. But, the tests for autoimmune diseases have grown. The number of autoimmune diseases that are recognized have grown, and also the treatment. So, immunosuppressant is something that we take. Say, for example, if you have a transplant, if you have a kidney transplant, for example, then you need to take an immunosuppressant your entire life. Otherwise, your body will reject that kidney that has come from a donor. So, some terms that we should understand: antigen. Antigen is something that stimulates our body to produce an antibody. An antibody is something that works against a specific antigen, like say you take a cholera vaccine, then you will produce antibodies against cholera virus. So it's specific to cholera. So we produce antibodies to different kinds of stimuli all the time, viruses and bacteria, and these protect us. Like once you get an infection, when you produce an antibody, then it protects you. For example, and the COVID example is very fresh in our minds, most of us. So for example, when someone gets COVID And if they don't do all kinds of treatment to overcome the COVID, then the body will automatically heal a viral infection and we will produce antibodies against that virus. And then the chances of getting another such infection are lower, much lower, because we have antibodies. Now, it's also assumed that when you take a vaccine, then you are stimulating antibody production by having a weak antigen similar to the actual antigen in the vaccine to stimulate the antibodies. So that's why COVID vaccine was given. But you know, COVID vaccine was suddenly prepared. There was no time to test it. And honestly, it didn't work very well, right? Because so many people got COVID even after having COVID vaccines. Now, um, you know, our immune system always responds to any stimuli. So, for example, we already talked about how it responds to a virus or bacteria by producing antibodies, but also to a vaccination to produce specific antibodies, and then to blood transfusions or transplant. We talked about transplants because a transplant is a foreign protein and a blood transfusion has to be done very carefully so that we have actually the same group, blood group transfusion done so that we don't produce antibodies to something. Same with the transplant. We have to make sure that the transplant is the, you know, proper for that person. But even then, once a transplant is done, because we can't afford to let that organ be destroyed, we take immunosuppressants our entire lives. When we get an autoimmune disease also, we take similar immunosuppressants so that the destruction of our own tissues stops. Now, this is very good, but we should also think, why did we start destroying our own tissues and how can we remove the cause of it? And then we can also produce immune responses to certain medications. Like, for example, you know, some people are highly allergic to certain medications. That's an immune response. And we can also produce immune responses to animal products and certain foods in our diet. Now, here we've all been told that we are omnivores, right? We can eat anything. But think about it. And this is just a diagram of a stomach. And stomach is where protein is digested. Now, protein is digested by the stomach producing hydrochloric acid and enzymes to digest the protein. So suppose you eat egg or have milk or chicken, it goes into the stomach produces enzymes in order to break down that protein so that it can become a part of our body. It can be digested. But how does the stomach know that this acid and enzyme should not destroy its own tissue? Like, how come this acid and enzymes doesn't destroy the stomach itself? And that's because our body is able to determine what is self and what is not self. And so usually the body will digest only the food, but not the stomach wall itself. However, in autoimmune diseases, what happens is, what if the food I ate has cells that are similar to my own cells? Then the body has identified these as foreign. It produces antibodies against these foreign cells. But these foreign cells are similar to my own cells. Those antibodies are going to destroy my own cells. So, for example, type 1 diabetes or juvenile diabetes is an autoimmune disease where the pancreatic cells that produce insulin are completely destroyed. But one of the reasons that they get destroyed, it has been found, is that cow's milk the cow's milk cells are similar to the cells of the protein in the cow's milk cells are similar to the protein in the pancreatic cells that produce insulin. Therefore, if a baby is given cow's milk at an early age instead of mother's milk, the chances of producing type 1 diabetes are much higher. Are you all following what I'm saying? Is this being understood? Can you type into the chat box? Dr. Urvi, any
Yes, ma'am,
response?
we have responses that say that they're with you.
Oh,
But
wonderful.
ma'am,
That
we have few responses saying that the screen is not yet up. So in case you're presenting something, you'll have to reshare.
the screen is not up.
Correct. If you're
Oh my
presenting
God,
something,
I'm so sorry. I'm so sorry. I'm really sorry. You know, this is my mistake. I'm sorry. I'm going to go through this. Really, I'm sorry about this. I'm just going to
it's
go
up.
through
Yes,
quickly
ma'am.
to
Now we
show
can
you
see
the
the screen. Yes,
screen share. I'm so sorry and
yes.
thank you for telling me. So
No
I was
problem,
just
ma'am.
talking about the Guillain Barre. I'm so sorry about this, and thank you, thank you. So I was sharing about the Guillain Barre and how it uh, attacks only the myelin sheath, and then we talked about immunity, and we talked about how we produce antibodies against our own cells. And thank you. And Dr. Urvi, please keep me informed. Sorry about this. And we talked about how antibodies are affecting our own cells. And we talked about the different types of autoimmune diseases. And we talked about how there are now over 100 types of autoimmune diseases. We talked about what antigen means and what antibodies mean. And we also talked about the natural immune responses to viruses, to vaccination, to blood transfusion or transplants, to certain medications, to animal products and certain foods in our diet. And I'm going to talk more about that soon. I was already talking about this, and we talked about how the stomach um, the stomach is able to determine, or our body is able to determine, what is self and what is not self, so that we only digest what is not self, what is a foreign protein. And then we were on this slide. Please forgive me for this problem. Dr. Urvi, please keep me updated if anything's going wrong. And are you all with me now? Okay, any response now?
Just a second, ma'am. I'll just read out. Yes, ma'am. I am seeing affirmative. We are with you. Yes, yes, we can hear you. Yes.
Okay, I'm so sorry about this. And Dr. Urvi, please let me know if I'm doing anything wrong, huh? Because I can't see everything
No problem, ma'am.
myself here. Okay,
No problem, ma'am. I'll guide you.
okay. So at least that was a revision for you on what is autoimmune diseases. And you know, in autoimmune diseases, there's something like leaky gut. So if you see the image on the um, left hand side, you can see that the cells within the gut are tightly packed against each other, which doesn't allow anything which is inside the gut to enter the bloodstream, which you can see here, right? So the cells are tightly packed. But when we consume foreign proteins and these affect us, then it can actually damage the gut wall. And you know, the protective part of the gut wall is the microbiome. And sometimes we damage the microbiome by taking too many antibiotics. Remember, I said medicines can also produce a autoimmune response. So the gut wall can be disturbed, and this means that foreign protein can enter the bloodstream as well. And when foreign proteins enter the bloodstream easily, then this can trigger another autoimmune response. So leaky gut is also a cause of autoimmune response. Now, aren't we supposed to be omnivores? Aren't we supposed to consume milk or meat? And the answer is maybe not. Because if you look at the teeth of a carnivore, and then you look at the teeth of a herbivore, and then you look at the teeth of a true omnivore, and now if you look at our own teeth, then our teeth look like that of a herbivore. And honestly, if you look at the digestive system, our digestive system is close to that of herbivores and far from that of carnivores. Now, I don't have time to go through all of this today, but this is something that if you're interested in, you can look up on the internet and see the differences between the digestive system of a carnivore, a herbivore, an omnivore, and us. But I do want to talk about one thing, and that is instincts. Because instinctively, we are naturally attracted to. Imagine if we were to go to a farm or an orchard and you see fruits and vegetables hanging there. Instinctively, we're naturally attracted to fruits and vegetables. Now, if you see a chicken walk by, or a goat, or a cow, no matter how much of a carnivore or omnivore you are or have been, your mouth doesn't water. And that's because we can't pounce on that animal, we can't tear it apart, and we definitely can't eat it raw, like a true omnivore or a true carnivore can. This means it's not our food. Similarly, with milk, every baby loves their mother's milk. But we know from logic or science that every mammal produces milk only for their young. And in nature, no animal tries to drink the milk of another species. That means pigs don't drink goat's milk, monkeys don't drink elephant's milk, but we do milk other species and drink it. So when we put the wrong fuel in our body, it's like putting diesel in a car which runs on petrol, it doesn't work. And that's the main problem. Today, we think that not only are we omnivores, but we can eat all kinds of packaged, what do you say, processed, packaged foods with chemicals and additives and all kinds of things. And our body has to deal with it. But it is not designed to deal with it. And so we have so many illnesses. So what we should really put in our body is those things that we are instinctively attracted to. Like a cow is naturally attracted to meat, and a lion is naturally attracted to, I mean, a cow is naturally attracted to grass, and a lion is naturally attracted to meat. So you can't put a lion, a lioness in the grasslands with her cubs. The cubs will not try to eat the grass, right? So we should also eat foods that are instinctive to our species, because putting the wrong fuel in our body is like putting diesel in a car which runs on petrol. It won't run very long. Am I clear up to now, and is everything going well so far? You can just type into the chat box.
Yes, ma'am. We have few questions, but I'll take it up at the end of the session. But most of the responses are towards yes.
Great. So, when someone has an autoimmune disease, the first thing is that it has to be diagnosed. And today we have more and more tests to diagnose all these 100 autoimmune diseases that honestly we did not have at the time when I became a doctor, or even at the time when I got Guillain-Barré. But nowadays we have, and so it's easier to identify, and it can be treated with a number of different things, steroids and immunoglobulins, like this was there at my time. but also plasmapheresis, that was also there at my time, and HCQS and chemotherapeutic drugs, immunosuppressants, and even biologics. Biologic is a nice name, but it's not as natural as it sounds. Now, this is a current system of treatment as opposed to our Sharan system of treatment, which is different. So the current system of treatment treats the symptoms. Oh, we have antibodies which are destroying our own cells. So let us destroy or put into control these antibodies with an immunosuppressant or immunoglobulin. Whereas Sharan's system is, let us understand what is the cause of this autoimmune disease. Why did it happen in the first place? And let us remove the cause altogether. So what happens is that all those all those antibodies that we have produced have a lifespan. For example, if you take a cholera vaccine, then you produce antibodies against cholera, and they have a lifespan of 1 year, or maybe a little longer than 1 year, which is why doctors say repeat the vaccine every year. As opposed to that, if you have a tetanus vaccine, for example, then you produce antibodies in your body that will last for 10 years, which means that every time you get an injury in the next 10 years, you don't need to take another vaccine, anti-tetanus vaccine, because you already have antibodies in your system that can oppose the tetanus. Now, it's the same when we have an autoimmune disease. We have produced antibodies in our system, and those antibodies have a lifespan and they will circulate in the system. So if we can understand what is the cause of producing antibodies, then we can avoid that cause. Therefore, we will not produce any new antibodies. And over a period of time, the antibodies that are already there will die in a sequential manner, so that every year the antibody load becomes less and less, and eventually the autoimmune disease is completely cured. So our treatment is avoid all foreign proteins. That means avoid proteins that nature would have never expected in our body. We should avoid the vaccinations, especially the non-essential vaccinations. And personally, I think I got my autoimmune disease, Guillain-Barré, from a rabies vaccination. That means I had a dog bite. I went and took a rabies vaccine. I already knew that I didn't want to take vaccines unless required, but rabies is scary. So I went back and I observed the dog, and the dog was fine. So I did not take further vaccines, but I still suffered from Guillain-Barré. Now, I can't be 100% sure that that was the cause. It could have been the cause. So our treatment would be, don't take any non-essential vaccine. Avoid all foreign proteins, right? Then reduce stress to the body to the extent possible, and allow the body to heal by throwing out toxins, reducing the antibody load, and healing the destroyed tissues. How do you throw out toxins? The body throws out toxins itself. We just have to stop putting in new toxins. Stop all those packaged foods and all the processed foods, the chemicals, the things that don't belong in our body. Reduce the antibody load by avoiding those foreign proteins, and allow the destroyed tissues to heal. So Sharan has a 5-point plan that everything should be plant-based, everything should be whole. Whole means we want foods with the highest nutrients. For example, if you eat beetroots or sugarcane, both of these have a lot of nutrients. But if you refine it into sugar or even jaggery, the nutrients diminish. Or if you have, say, rice bran or sesame or mustard or peanuts, all of these have nutrients. But if you take out all the good and just keep the oil and refine it and sell it, there's no nutrient value in that. It is only calories. These are foods that we should minimize. So everything should be plant-based, everything should be whole. Maximum nutrients are just under the skin. So we don't peel vegetables and fruits that we can't peel with our bare hands. And nutrients are the spare parts for healing. So we want to flood our body with as much nutrient as we can. If possible, more raw foods in order to get well. And definitely, we are the only species that sprays our food with poison so that other animals don't eat it and then we eat it. So we should make sure that we don't eat non-organic foods, only eat organic. And then check and supplement vitamins B12 and D, because vitamin B12 is only made by bacteria. And today we lead a super hygienic lifestyle, and vitamin D is only produced by the action of the sun on our skin. And we as Indians, we're not so much out in the sun because we don't like to tan. But even if we are, our cities are so polluted that the direct sun rays don't come to the skin. They come through those layers of particles in the air, and so we don't produce enough vitamin D. Now, an autoimmune disease takes time to recover because the antibodies have a lifespan, they need to die. Then the damaged tissues, once the antibodies are completely out of the system, then the damaged tissues can heal. Till then, there might even be further damage. And then a few important points. Autoimmune diseases take time. The recovery may or may not be complete. The recovery can be complete if the damaged tissue is one that can regenerate. For example, damaged skin can be regenerated. So psoriasis can heal completely, or vitiligo can heal completely, and we've seen cases of that. But for example, nerve tissue does not regenerate completely. So it might be difficult to recover from multiple sclerosis or something, but still it's important to treat properly so that we don't create any further damage, right? So we have to understand whether this situation can be reversed or at least controlled and go into remission. So just one cheat meal on animal products can actually slow down recovery. In fact, there are people who say that you should not even apply animal products to the body because everything that we apply on our body is absorbed in less than 26 seconds. So it would be best to avoid these to the extent possible. And it's best to avoid animal ingredients. I told you in personal care products, vaccinations are to be avoided. In fact, we have seen so many autoimmune diseases increase after COVID vaccine. And I do want to say that talks like this can never replace a personal consultation because this is a process where everything has to be understood. Medicine should not be stopped suddenly because if the medicines are stopped, then the destruction of the tissues can take place and then it's going to take more time to heal. So we have to weigh the pros and cons in every case individually. but we have to recognize that medicines never cure anyway. So we have to decide whether it's worth putting the medicine load on the body or avoiding it, like I did. Now, how can Sharan help you heal autoimmune diseases? So just to let you know, we have a lot of recipes on our website. Our website is sharan-india.org. You can see at the bottom of every slide. Um, we have basic cooking class and events, different kinds of cooking class to teach people how to replace the animal products in their diet, how to make fabulous curd without cow's milk, or cheese without cow's milk, or make meat alternatives. And we have a newsletter and WhatsApp broadcast list which teaches little bits of, gives you little bits of information in a short time. We have a team of doctors and nutritionists that provide consultations online and in person. And we also have retreats where you can get well on the spot while having good food and having a good time. So these are some of our publications, and I'm just going to take you quickly through our website and then open for questions. And these also, and these are some photographs of our 21-day health retreat where we do all the tests at the beginning and all the tests at the end. And during the retreat, we cut down medications and help people get well so that they can see how good food actually heals and how without medications they are so much better. But I have to say that autoimmune diseases do take time. And so autoimmune diseases cannot recover just in a matter of 21 days. I do want to take you quickly through our website very quickly. So this is a consultation section, and we have all kinds of consultations by doctors and nutritionists, and it's just opening and loading. Um, and we also have a health coach which helps you, who helps you change your habits. My God, it's loading really slow. This is embarrassing. Um, okay, but so we won't go there. We also have 600 recipes on our website that you can avail of, which teach you how to cook healthy but very delicious food. And I wish I could show you this, but I'm going to have to leave it to you to see yourselves because it's loading very slow right now. And we also have events that I mentioned and cooking classes and so on. So that's it from me. You can take the website address, and I'm going to stop the screen share now and open up for questions.
Thank you so much, ma'am, for taking us through the topic so diligently. And I'm sure it was an eye opener for me, as I'm sure for a lot of us. So, without further ado, I'll quickly read out the questions. The first one is HSP autoimmune disease, and is it reversible or not?
HSP.
Correct, ma'am.
Okay. I'm sorry that I'm actually hearing this short form for the first time. So I'm going to look it up actually. Oh, yes, I've heard of it before. Sorry, I have heard of Henoch-Schönlein purpura. And yes, it is an autoimmune disease. And yes, it can be definitely helped, I believe.
Sure, ma'am.
Does that
Next
answer the
question
question?
is absolutely, ma'am. How did you determine the cause of for the autoimmune was rabies vaccination? Is there a specific test to confirm this?
No. So, I mean, even in our medical books, it was written that Guillain-Barré, I mean, at that time, so many years ago, it was written that Guillain-Barré can be caused by eating chicken, or it can be caused by vaccinations. So I was just trying to put things together. And as I was a vegetarian, chicken was not in my arena, but I had definitely had rabies vaccine. Therefore, but as I told you, I can't be 100% sure. And that doesn't mean that you should not take rabies vaccine, right? Because rabies can be more dangerous than autoimmune disease, and not everyone who takes a vaccine gets an autoimmune disease. So we always have to weigh the pros and cons and see what should be done. But what we should do is not take vaccines that are not required. Like today, there's so many autoimmune diseases, and yet there are so many people taking so many vaccinations, more than ever before in the in the history of humanity. So is there a connection? Possibly there is. Does
Next
that?
question is, ma'am. Yeah, that does, ma'am. Next question is around psoriasis. How do identify the cause for that, and the skin irritation increases during winter? Any recommendation for that?
So as I said, remember that the main causes of any autoimmune disease are wrong diet, especially animal products in the diet. Then foreign proteins in the form of, like, an autoimmune disease can be caused by virus, even a virus, because it can stimulate this autoimmune response. It can be due to a vaccination, and of course it can be due to the transplants or the blood transfusions or whatever. That's why we want to minimize all these things to the extent possible. And the thing which is under our total control is what we put in our mouth. So let us minimize the one major cause of autoimmune diseases. Does that answer this question?
Yes, ma'am, it does. Next question is, ma'am, can you advise on what are the lifestyle changes that are causing more autoimmune diseases? Anything that we need to avoid? Any recommendation?
So this is kind of the same answer. We should avoid all animal products altogether. This is the number one thing, because this is a foreign protein which is in our hands. 100% avoidance of animal products, because see, if I avoid all the animal products, but just one time take a spoon of milk in my tea, then that spoon of milk can trigger a new autoimmune response. I produce new antibodies, and now my autoimmune disease is going to last longer. It's just not worth it. And we are living in a time where, because there are so many autoimmune diseases, there are also so many alternatives. Like, instead of milk, we can have coconut milk, rice milk, oat milk, soy milk, etc., etc. Why are we, allowing ourselves to get sick? Does that answer that question?
Yes, ma'am, that does. Next question, ma'am, is around, just give me a second. So, ma'am, someone is asking a personal question. I had DVT and PE in 2015. Do I need to take anticoagulant medication for lifetime?
So look, I can't answer personal questions right now, because if in order for me to answer any personal question, or in order for me to do a consultation, I would require the entire history. I would require to know what medications are being taken altogether, and how bad it is at this point, and what the dietary history is. So I can't really answer this, but I've told you the general thing, right? In general, if someone has an autoimmune disease, then we have to check if the antibody titer is going down. And as it goes down, we have to reduce the medications. And when it is gone down to normal or almost normal, we have to stop the medications. So we have to keep testing and reducing accordingly.
Next question, ma'am. Just give me a second. I will pull it about. Okay. So, What is the autoimmune condition that leads to vitiligo, and is there any permanent cure for that?
As I said right in the beginning, yes, definitely. And I've explained all through this whole talk the different causes of autoimmune diseases. Is that clear?
Yes, ma'am. I'm just waiting for the next question.
Hmm.
Okay, so someone is writing that they have been consuming non-vegetarian food since their childhood, and suddenly it feels very stressful and difficult for them. How can they manage this transition in a healthy and practical way without feeling mentally disturbed?
Exactly. I totally understand. And I was in the same boat because I grew up as a vegetarian, and vegetarians and non-vegetarians get the same disease because meat and milk have the same properties: high protein, high fat, no fiber, and they're not our food. So it is like any change is difficult. Even if we're sitting every day at the dining table with our family, we tend to sit on the same seat every day. Even changing the seat at the dining table is difficult. Changing your job is difficult. Changing your school is difficult. Changing your home, country, whatever is difficult. However, once you make the change, it becomes very easy. And that's the beauty. We are creatures of habit. And when we make the change, it's so difficult. But once we make it, it's so easy. It's just learning a few new things. Like we make fabulous pizzas and fabulous curds, raita, curry, everything without using any dairy. Or we make meat alternatives really delicious. And if we can just think different and make these changes, imagine living a life without disease, leave alone autoimmune disease. Imagine living a life without disease, and that is the goal of Sharan. So it's possible. And for those who think it's very difficult, that's why we have the retreats. Because in the retreats, we serve buffets of food every day. You can pick and choose what you like. You can really enjoy yourself with multiple activities and get well in that time. Does that answer the question?
Yes, ma'am, it does. The next question that I have for you is that someone is writing that they're suffering from HLA-B27 syndrome and they take medicines for almost 6 years. What could be the diet that can help control them? Is there a specific diet regime that they need to follow for this, or any other thing?
So once again, all these specific questions, I've told you the general, and honestly, the general will help everyone with an autoimmune disease. But these specific questions need to be addressed with a consultation. Truly, I mean, there's no way that I can bypass that. And of course, I just want to let you know that anyone can avail of our consultations with our doctors and nutritionists from our website. We also have a health coach which helps you build healthy habits, not just in food, but also in total lifestyle, like the time you go to bed, or the rest you get, or the exercise you get, or how much water you drink. Put everything in place and get results. We are very result oriented. I mean, why do I do a 21-day health retreat? And many people tell me that, hey, you could do a shorter retreat, more people would come. It's easier for people to pay less and come for shorter time. But the truth be told, it's really, you cannot reduce medicines and get results in just 10 days. It's already a miracle that you can get well in 21 days. How can we make it shorter than that? Right? So, yes, we can make it shorter, but that would just be a lifestyle change, not um, result oriented. And it takes 21 days to change a habit. And I think it's really important to take that much time out for ourselves, because if we don't take time out for health today, sooner or later it finds its way on the top of our agenda, doesn't it?
Next question is, ma'am, as a 35-year plus woman, she's saying that she feels good for most of the time, but is there any regular test that they can do to ensure that they don't have or later have autoimmune diseases? Any input on that?
I don't think we have to do tests just to check that we don't have autoimmune diseases without any symptoms. If you're totally healthy and fine, I think let's just adopt a healthy lifestyle so that we don't get other diseases as well. And so I invite all of you to come and attend some of our programs just so that you can understand how to make the changes, what exactly changes to make, because, as you can see, it's already 4 p.m. and I can't cover everything in just an hour. Remember that we have a 21-day health retreat where we have a little time for health talks every single day. And still we can't cover everything in just 21 days. So, but we cover, of course, in the 21 days, we cover everything that our participants need, obviously.
Ma'am, next question is around, is it possible that lumbar spinal stenosis, disc bulges at early age can be a cause due to autoimmune diseases? Is that possible?
Lumbar spinal stenosis.
Right, ma'am.
It's always possible because it could be something like ankylosing spondylitis or something like that. So it is possible that it is an autoimmune disease and it should be checked.
Um, Ma'am, next question is around someone is saying that recently they've started noticing certain gut-related issues, and the frequency is getting more and more with each week, is what they are mentioning. Should this person go for some testing to just reassure that it's not autoimmune condition?
Definitely, it should be investigated and tested. And remember one thing, that if we put the wrong fuel in our body, the first thing that's going to be affected is the digestive tract. So even without doing that, like if you don't want to go in for testing, then you can switch to a healthy diet and see the results. And if the results are good, then you don't have to go for testing. Does that make sense? Are we all good?
Yes, ma'am. So next question, ma'am, is around IBS. Is it autoimmune disease, and any preventive or any maintenance that needs to be done for this?
Absolutely. It is an autoimmune disease in many cases. Not all are not diagnosed also properly, but it can be autoimmune disease and definitely needs to be treated in the best possible way. But look, every IBS, one has to discuss with the patient which are the foods that suit and which are the foods that don't suit. And one of the things that you can do to kind of understand is the food sensitivity tests. Remember one thing, that all specific issues need to be helped with the help of a consultation, because nobody can tell you without looking at the reports and knowing the lifestyle what needs to, and knowing all the symptoms. So we have, when someone books a consultation, they have to send in the reports, they have to fill in a patient data form, and then we assess. And our consultations, a new consultation is an hour long, just so that we can actually get results.
Ma'am, next question is, you mentioned about milk. Is it same for all the milk products as well? Do one avoid all the milk made products to avoid autoimmune diseases?
Absolutely. Just because it's not our food, right? I mean, as long as you are not a calf, you should not drink cow's milk. It sounds like not obvious, and honestly, it's very obvious because cow's milk is for calves. If I go to a kindergarten kid and ask them, dog's milk is for, they'll say puppies, and cat's milk is for, they'll say kittens. And then if I ask them cow's milk is for, they will give the right answer. But today we don't have the right answer just because of our conditioning. In fact, our diseases are due to our conditioning by our culture, our society, and advertisements.
I think we don't have much time, ma'am, but I'll just take a couple of more questions since a lot of people have added it over here.
And I
Okay,
just
so
like to take all those questions which are not specific to personal problems. Okay? Since anyway, I can't answer those.
sure, ma'am. Then I will just take one last question. It will be more of a generic question. Then I would say, ma'am, we heard you. We heard your inputs. There is a rising trend towards autoimmune diseases, and that is for sure. Um, any advices from your end that one other than the dietary impact that you have shared, any general advices that you can share with the audience so that they can ensure that they live a more healthier life, and in case someone is having autoimmune within their family, what kind of maintenance they can look forward for? I think those two questions would be the last questions that I have with
And this is a repetition of what I've already spoken. But general thing is that everything should be plant-based, whole, organic. Vitamins B12 and D should be checked and supplemented. And what kind of a plan they should have really depends on a lot of features, and therefore they should go in for a consultation because nobody can give this advice. It's too serious a disease to give this advice, right? So nobody can give this advice like this on in public like this without knowing the details. And the kind of tests that need to be checked are listed on our website, but there are others specific to the symptoms so that the doctor can only tell you once they have been able to identify what the problem is.
Noted, ma'am. Uh, I think, ma'am, with this we will wind up the session. We are overshooting the time. I would like to extend a heartfelt thank you and gratitude for taking out the time and sharing such wonderful insights with the audience today over here. I think it was completely an eye opener, at least for me, and I'm sure for a lot of us, because we never could have imagined that the day-to-day life, milk is something that we take in almost everything. It's really asks us to think more in the kind of lifestyle changes and the lifestyle choices that we make.
Yeah,
So
and you know what? I just want to say that sometimes I'm treating patients and their family is with them, and I often tell them that, look, this is the healthiest diet for the whole family. Like, why should somebody get well under my guidance and other people get sick during the same time? So you all follow the same lifestyle. And most of them tell me that they are feeling so much better. We just don't recognize that we're eating the wrong food. Like if we have a cow, we will not give it meat. If we have a lion, we will not give it grass. But we do all kinds of things to ourselves. Is it worth it?
absolutely, ma'am. And thank you, ma'am, for asking us to think on those lines. And I'm sure it's a soul searching question that a lot of us will be doing, at least for the next 15-20 minutes, if not for more. But thank you so much, ma'am, for your time. And thank you, everybody, for being there and being such a patient audience and listening and asking and interacting so actively. I am sure a lot of you would have gained much knowledge and you will be better equipped to deal with any autoimmune diseases in the family or near and dear friends. And with this, I will close the session for today. Very happy weekend to all of you, and we look forward to have you in the next session. And thank you, everyone. And thank you so much, Dr. Nandita, once again for your time.
Thank you. And I thank you and Prudent Insurance for inviting me here. Thank you for that.
Thank you so much, ma'am. And take care. We will see you soon, I'm sure, in another of our sessions. Thank you so much, ma'am.
Thank you.